There we go. Okay.
Great. Perfect. So I'm recording now, and if we'll just start, I know we're talking about vaccines and the vaccination rate, and I know there's been challenges around the country, and I looked at the CDC data just in the Carolinas, and one thing that kind of caught my attention is it looks like North Carolina has a higher distribution rate than South Carolina, but a lower administering rate of the vaccine than South Carolina. Why do you think North Carolina's vaccination rate is so low compared to other parts of the country?
Well, first, I would say we're just a couple of weeks into this, and I want folks to remember that. And remember, we're working with local partners on the ground who are doing vaccinations that are also deep into responding to the COVID pandemic itself, right? It's our hospitals and our local health departments. So they have a lot going on, in addition to the fact it was the holidays. But I think everyone shares that sense of urgency to move fast here, right? To get vaccine into our. So at the state level, we did prioritize getting vaccine out quickly to everyone and everywhere. We wanted to make sure it was in all 100 counties, which means we worked with a lot of partners to get them vaccine. And that means some partners are fantastic and got that vaccine into arms really quickly, and others need some more support and didn't do it as quickly. And so I think you see that variation, but we made the choice to work with all 100 counties because I thought that was important to prioritize getting vaccine everywhere in North Carolina. But now we just need to work on helping the folks who do need that support, our local health departments and hospitals who need support in turning around those vaccines and getting them into arms.
Okay. And I talked to a local health official he said one of the challenges for them is not getting the lead time on when the shipments are going to be coming, and that plays a role when they're trying to plan vaccine clinics with thousands of people. How do you think that can be improved? Is there a communication issue on the state level, the federal level, or somewhere else?
Yeah, no, Alex, I think that is a great point that that provider is making. And right now, we don't get a lot of lead time from the federal government and knowing what vaccine is coming to us. I think we're working with them, and it's getting better. Again, we're just a few weeks into it, so we're sort of learning what is going to be our sort of steady state of vaccine that's going to come to us every week. So I think we are starting to get more of that certainty at the state level so that we can give more of that certainty to our providers. I think that's exactly right. It's been hard to plan when you didn't know exactly what was coming to you and how much. I think we're starting to understand that certainty so that providers can ramp up to higher levels of vaccination rates per day. And I see them doing that. And some have been great. And I know as we turn to this next group that's getting vaccinated, which is those who are over 75, I think that's when you'll start to see us really, improve that turnaround time. So I'd ask everyone, little patience as we work out some of the issues on the ground. Like I said, some folks are doing great, and we want to facilitate those who are doing great to run fast and support those who need our support.
Do you know why the information's been kind of last minute from the federal government?
I think we're all been trying to work quickly here. And so I'll just say we get information from them on a Tuesday about how much we're going to get. By Friday, we have to tell them where to ship it, and by the next week, they're shipping it. So, I mean, these are rapid cycle times here. It's because we want to move fast, but at the same time, it means we don't have as much visibility as we would like. So we're all trying to work hard here. I think, we are going to improve that process as we go along here, and we get some more of that certainty. I think we have some better certainty through the month of January, and that helps us plan at the state level.
Okay, so looking ahead then, with some improvements you're anticipating as we move into the coming weeks, what would you like to see the vaccination rate become, 2 weeks from now, and what needs to happen to get us there?
Yeah, so first it's having folks understand what to do. So if you are over 75, starting this week and next week, your local health department and your hospital is going to start vaccinating your group of folks. So if you're 75 and older, call your local health department, call your hospital. They're taking appointments. Now, doesn't mean they're going to have an appointment for you this week, maybe not even next week, but that process is starting. And again, some places are still working on their healthcare providers, might not quite be ready for those over 75. So I think we still have some time here before I can give you a number of this is how many we want to do. But I think we want to be getting out the vaccine that we're getting in each week that we're want to getting out, right? If we're getting it in a week, we want to be using the majority of it by the end of that week. It's never going to be perfect because of the way the vaccine moves around, but the way we have to defrost it and all that stuff. But we want to be seeing a higher rate of vaccination. And I know that folks are working towards that now that we're out of the holidays, that folks are understanding the process a bit more. I know folks are making those improvements.
And one quick note about the, a letter that the state sent out to kind of encourage that to different health departments and hospitals is saying, hey, the future allocations will be based on how many you're administering now. That's kind of like saying the more you use now, the more you'll get later, right?
Well, we don't want vaccines sitting on the shelf. So if you have vaccines sitting on the shelf, we're not going to send you more. And I think those that are working hard to get high throughput and a lot of vaccine out, we want to get them more vaccine. However, we need to balance the geography, right? So we don't want to just have all that vaccine maybe go to the east and not go to the west. So we do have to work to make sure that we're getting an equitable distribution, both geography wise as well as to the different populations we want to make sure are getting access to this. So it's very important to me, to the governor, to make sure that we are getting an equitable distribution of this, to make sure our African American community has access to this, and it's to our Hispanic Latinx community, as well as our rural community. So we do have to balance it. So we can't just give it to the best ones because we still need to work on everyone. So our job at the state is to also support everyone in being able to give those vaccines across our state. And I think that's what we're working towards.
All right, well, super helpful information. I just have one more question on a different topic about, it's obviously had a huge impact on England, and we're starting to see it here in the country about the new strain.
Yeah.
Has North Carolina seen any cases of this new strain, and how is it being monitored here? What's that process like?
We have not officially identified that variant here, though we do send a number of our samples from North Carolina to be sequenced by the CDC. So I expect for that variant to be identified at some point in the coming weeks. We are operating as if it's here. And that means taking the precautions that this virus could just become more contagious. And it goes back to the same things you've been hearing from me for many months about masks and social distance. And you're going to continue to hear us really harp on the individual actions we can all take to protect each other.
Are you worried it'll affect like hospital strain that's already strained?
No, I am worried. If more contagious means more people getting this virus, and that means proportionally more people in the hospital and more strain. That's why we're racing as fast as we can on the vaccine side to protect our most vulnerable, but it's also why we cannot let up our guard right now. We gotta be wearing masks. We gotta be socially distant. Please do not have folks over your home indoors. Do not go over other people's house indoors, right? That's the place we're seeing a lot of viral transmission right now. So we really need to focus on everything we can do to slow the spread.
Well, again, really appreciate your time, Secretary Cohen. Good to talk to you kind of face-to-face, right?
That's right.
Yeah, thanks again. And I'll be in touch with any other questions, but I appreciate you making time for us.
Terrific. Thanks, Alex. Great to see you. Stay well.
All right, you too. Take care. Bye now.